Hi, this is Dr. Virendra Sodi, first Ayurvedic and naturopathic board certified physician in USA. Do you know that the 63% patient who got hospitalized with COVID-19 has hypertension? I will tell you 5 tips to control your blood pressure so that you can cut the chances of getting COVID-19 and its complications. Tip number 1, do breathing exercise, which is called Pranayama in Sanskrit. Prana means vital, very, very vital, which is the most important thing for you. As you know, if you don't breathe, people will start calling 911 because you're not breathing. So the Pranayama means you increases your life by breathing. So this breathing, which I'm going to tell you, will lower your blood pressure by 10 to 15 points, diastolic and systolic, immediately. And you can see it. Do it for 10-15 minutes in your home and measure your blood pressure before and after, and you see the results. And I would like to have comments from you. See, you will drop it. I'm telling you, I'm betting on it. So please help me, spread this free knowledge, because this is the free medicine, which I call it. So what in this breathing, which is also called vagus stimulation breathing or parasympathetic breathing, you are involving your belly. It's also called belly breathing. So first you breathe through your belly, brings your belly out. And once the belly out, then you fill your lungs. And then you hold as long as you can without killing yourself. And when you start to feel a little uncomfortable, then you let your lungs go first and then let your belly go second. So again, first belly, you comes in the belly, and then you fill your lungs, and then you hold as long as you can without too much difficulty, and then you let your lungs go and then let your tummy go. So if you repeat this cycle, which is is stimulating your parasympathetic system. When you stimulate your parasympathetic system or vagus nerve, it calms you down. Why it calms you down? Because it cuts down the production of your cortisol, which is zitry hormone, epinephrine, norepinephrine, which actually jabs you. Those are flight and height mechanism hormones. When you need it, like you need to fight or you run, somebody's running after you, or somebody is chasing you, or you see a car coming on you, you have to run very quickly. Those hormones comes at that time. But you don't need those hormones all the time. When you have these hormones all the time, which is our societal pressure has done to us, we get disease like high blood pressure. Number 2, meditation. Meditation is an amazing tool. A lot of research done all over America, all over the world. It brings your blood pressure 10 to 15 points down too. And it's again a free medicine. You're not going to make money out of just telling people how to breathe and how to meditate. This is a free medicine. The research shows when people do 20 minutes of meditation twice a day, which is, what is meditation? A lot of people has a hard time understanding meditation. Some of people think you just sit and you're trying to force hard to focus on something. Meditation is not focus. Meditation is learning to live in a moment. And you shift as you live from one corner to other corner of the day. And when you try to live in that moment, your life becomes very, very different. Most of us, either we live in the past or in the future. And we are destroying the present. And what you live is the present only. Past I can't change, future I don't know. So start living in a present moment, and that's how you want to do. Practice living in the present. And in Sanskrit it's called dhyana. Dhyana means awareness. You live in awareness. You present yourself in awareness. When you are in awareness and you learn it again and again, it's like a practice, okay? If you're a basketball player and you are a wonderful top-notch basketball player, now you don't go to the court for 1 month, what will happen to you? Your game will be destroyed, isn't it? The people will beat you very, very quickly because they say you're out of shape. So if you don't practice daily, you're not going to accumulate the effect. But if you practice, you know what level of peacefulness you can achieve, and you will be easily, very quickly get to that level of peace very, very quickly, and your body will be wonderfully, very, very happy. Number 3, nutrition. Garbage in, garbage out. What kind of food are you going to put in the system? Your body is going to react. Unfortunately, our food chain has been very badly corrupted. We have put so many chemicals, so many fertilizers, so many preservatives in our food that we are not eating the food which our forefathers were eating. We have entirely bad food. And I encourage here, this is my hand-folded request to all of you guys. If you want to stay healthy, please follow organic foods and food which are grown locally. Don't try to buy the food which is grown outside, because then there is a different impact. So support your farmers, local farmers, and that will be life-changing experience for all of us. We have food which is so much rich in sodium these days because we have packaged food. Your packaged corn chips, your potato chips, and so many other chips are available. I don't even know the names of, because I don't eat that garbage. But if you see, the whole shelves are full of that, and people are just picking it like candies from there. And so average American is consuming a lot more salt. American Heart Association recommend that we should eat 2,300 milligrams of sodium per day. But average American is almost taking double the amount. And he said, where the salt is coming from? A corn chip, right there, bag will have more than 2 teaspoons of salt in there. If you cook at home, you're not going to use that much salt in the whole family cooking. So you can see that we are adding so much extra salt in our system. So when folks had a 20%, when the folks has a more sodium in the urine, they had a 20% more chances of getting heart disease and stroke. But there's another important ratio. We are not eating potassium-rich foods, and I will tell you which are potassium-rich food. So there is a sodium to potassium ratio get disturbed, and when people has a high sodium, low potassium intake, the ratio changes, and that increases 50% chances of getting more heart attacks, strokes, and other related diseases, and even diabetes, by the way. So what foods has more high potassium? Your fruits and vegetables. Banana. Banana has around 480 milligrams of potassium. It has been actually propagated very nicely. Almost everybody, even his kid, know banana and potassium. But people don't know that all other fruits and vegetables have potassium. Avocado has same amount. One avocado has same amount of potassium as a banana. Your spinach, beets, and kale, chard, berries, has sweet potato, full of potassium. We will give you the list, potassium-rich foods here. So if you add more greens, green vegetable fruits, so you're not only adding more potassium, you're also adding fiber, you're also adding phytonutrients, you're also adding enzymes. All those overall effect is you are going to stay healthy. And it's a free medicine again. This is under your control. You don't have to pop in a pill to bring your blood pressure down. When you're adding the more potassium-rich food in your diet, your blood pressure drops again. Number 4, use Ayurvedic herbs. I'm going to tell you this interesting story here. There was no allopathic drug for blood pressure. There's a doctor, Dr. Vakil, out of India, who was the first cardiologist of Indian origin, and he studied in England, and he introduced a herb called Revolvia for blood pressure. And initially they used the Revolvia tincture and then the root powder for controlling the blood pressure. Then there was a drug company. They came along and they separated reserpine, one of the alkaloids. The Revolvia has many alkaloids, not only one. So reserpine was one alkaloid. We separated, synthetically made it, and started using as a drug, and had a lot of side effect. But when you use the whole herb, and in Ayurvedic medicine, we don't use herbs only singly, we use in combination. So the idea behind is that you want to increase the efficacy, cut down the side effects, and increase the absorption of it. So we use herbs like rose powder, we use herbs like Tribulus terrestris, Behavioria diffusa, Terminalia arjuna, Convolvulus pluricus. This combination have shown amazing results in bringing the blood pressure in people. So this is again, very interesting. You can cut down the dependence on the pharmaceutical and remodel your blood vessel. So one of the things which this combination does, it remodel your blood vessel. When you remodel your blood vessel, your dependency on drugs reduces. So after taking some time, these herbs actually, not medication, your blood pressure is going to naturally drop. Number 5, go for a walk. Not only do the walking, because I said it to you, enjoy the walk. Stand by a tree, look at it, look at the leaves, look at the flowers, smell the roses, look at a bird, look at a bug. Maybe you've never seen this bug before. Since I have increased my watching, and I have noticed so many different birds and finches, which I have no clue what kind of those are, but it is amazing that I said, oh my God, the colors, the beauty, the small size of them, and the efficacy of them, how they fly between the bushes up and down. I think even the most trained pilot cannot do the efficacious flying these birds. This is very wonderful. So enjoy that Mother Nature. And if you follow these 5 tips which I told you, not only your blood pressure is going to drop down, you will be happier, and even COVID-19 is not going to touch you. If you got it, the symptoms will be so mild because you have cut down the risk factor, hypertension. Namaste. This is Dr. Virendra Suri.